how would you describe what exactly a relative value unit is, and how does that relate to the CPT codes in the context of a charge master?
I do strongly believe that knowledge of relative value units and using data about relative value units and setting your charge master is the best business practice for a number of reasons. Most importantly, just from a logic perspective. But so let's jump back, Parker.
Okay.
So a relative value unit, or RVU, these are numbers that are assigned to different CPT codes. So any single medical or mental health procedure that you can have. So for knee surgery, for a physical therapy session, for acupuncture, there's going to be a CPT code for that. And then a relative value unit is a number that the federal government for Medicare, so Medicare is the health insurance that everyone qualifies for when you're 65 or older, or younger if you get disabled. So the federal government assigns values called relative value units for every single CPT code that exists. And there are hundreds and thousands of these codes. What the government does is it breaks every procedure down into 3 different pieces that each have a RVU assignment. So the first one, and maybe the most important one, is called the work RVU. So that means that for a given CPT code, the federal government has said this is worth X number of RVUs of, quote, work to do this procedure. And we'll pull out some actual numbers in a little bit for common procedures. The other 2 pieces that go into the RVU calculation, one is for your practice expenses. So if you're practicing in Little Rock, Arkansas versus Seattle, Washington versus San Francisco, California, there's different costs associated with renting an office, furnishing your office, equipment you need to buy. And so that's called the practice expense RVU component. And then the final component to RVUs is a malpractice insurance cost, which again varies by specialty and for the services you provide. So those 3 pieces, the malpractice cost, practice location cost, and how much work the actual procedure you're doing is, that's what makes up the RVU for a given CPT code in the region you're at in the United States.
Wow. Okay.